New this morning, we are now learning more about drug abuse patterns in teenagers. Which ones are the most popular? What you should know about e-cigarettes and prescription drugs. Joining me now live from Washington, D.C. is Dr. Wilson Compton with the National Institute of Drug Abuse. Good morning to you, Doctor. Thanks for joining us. Appreciate it. And you really are now announcing the results of this major study that's been done involving 8th, 10th, and 12th graders. What is it revealing about drug use among these teenagers?
What we're seeing in this long-term study that's been conducted every year since 1975 is the drug use trends are going down for many substances, but remain unacceptably high for teens to be healthy. So there's sort of two messages. One, I think parents and communities are doing a good job in reducing alcohol, in reducing cigarettes, in even helping reduce the number of painkillers that are misused by teens. But we see dangerous numbers of kids using marijuana on a daily basis, and we see real concerns around e-cigarettes.
And what other kinds of drugs are you also seeing in this? Because, of course, we've heard about K2 and Spice, those drugs that are kind of marketed to kids, let's say at convenience stores, where I don't think they realize that they're dangerous because they look more like maybe an herbal supplement than anything else.
Well, I think that's right. When you buy it in a public place, you think it would be safe, and yet these can be very dangerous. They're not designed to be taken into your body, and what they can do is produce major mental symptoms like psychosis or paranoia. They can really cause major problems from those synthetic cannabinoids. So those are synthetic products that are similar chemically to marijuana, but not the same at all.
We've seen this push, of course, to legalize marijuana throughout the country. Several states have already done that, basically, and there's a lot of talk here in Florida about medical marijuana. What is the message here for parents in particular who are watching this morning about the dangers of marijuana? Because kids might think, well, if they're going to legalize it, it must be fine.
Well, I think that's true. Kids are listening to the same message that everybody's hearing. So we do understand that what may be changing in terms of our social acceptance of marijuana for adults, no one thinks that a 13-year-old ought to be smoking marijuana on a daily basis. And so that's the real concern, is how do we equip parents and communities to make sure that children are raised in a healthy way? So how do we set firm limits on behavior, but also providing a loving, nurturing environment? That's the trick that all parents face in taking care of their teens.
Yeah, it's interesting, too. Do you find that that teens tend to have the theory that, and parents are unaware of, that they start maybe with marijuana and then that leads into experimenting with other drugs that could be even more harmful?
Well, I think that's a real issue for teens. Teenagers are naturally curious. Their job in life, their challenge, is to begin to try to experiment with almost everything. But many of the things they experiment with will be dangerous and will lead them down a pathway that can be devastating and life-changing, and that's what we really want to avoid.
It's interesting. My 8 and 11-year-old, of course, anytime they see anyone smoking or see a cigarette when we're out and about, they're like, ooh, gross. I mean, that message is definitely working. It's starting in elementary school and moving into middle school. But are you finding then that kids are experimenting, let's say, with e-cigarettes, which arguably could be, just as harmful?
Well, I think that's really the concern, is that we've done a terrific job in reducing the use of regular cigarettes, of those smoked products that smell so much that ruin our health. But we haven't quite figured out what to do around e-cigarettes, and the teenagers, just like everyone else, are quite curious and are taking these up. And yet we don't know what's in them. So these are unregulated products where we don't even know exactly how they're manufactured or what's in many of them that are sold over the counter in so many places now to anyone.
Just have to continue that conversation with our children, regardless of their age, without a doubt. Dr. Compton, thank you very much for joining us this morning with the National Institute on Drug Abuse. Do appreciate your insight.